Dear students, welcome back. Now we are going to discuss about the components of the shoulder complex. In that, we are going to discuss about the sternoclavicular joint. This sternoclavicular joint serves as the only structural attachment of the shoulder complex and upper extremity to that of the axial skeleton. And this sternoclavicular joint is a plain synovial joint. It is a plain synovial joint with 3 degrees of freedom of motion, which contains 3 degrees of freedom of motion. In that, 3 rotatory and 3 translatory motions, that is called as 3 degrees of freedom of motions. And it has a joint capsule. It has a joint capsule and 3 major ligaments and a joint disc inside the joint. Okay. So now coming to the articulating surfaces. The articulating surfaces are the sternal end of the clavicle. This is the sternal end of the clavicle. Articulates with the clavicular notch of the manubrium sterni and also the first costal cartilage. So what are the articular surfaces of the sternoclavicular joint? Are the sternal end of the clavicle articulates with the clavicular notch of the manubrium sterni as well as the first costal cartilage. And the sternal end is larger in size. The sternal end of the clavicle is larger in size and which is covered with a thick layer of fibrocartilage, and it is convex vertically and concave anteroposteriorly. You can see the concave anteroposteriorly. So here you can see the medial side of the sternal end, which is having at the center, it is having some depression that is called as concavity in anteroposterior view portion, forms the medial end as a saddle shape. So it forms as a saddle shape like this. The medial end of the clavicle will be present. So overall on vertically we can see this one as convex, whereas at the anteroposteriorly it is concave. Okay. And the clavicular notch of the manubrium sterni is relatively smaller and it is not reciprocally curved So because of this asymmetry of sternal end of the clavicle and the clavicular notch makes this joint as incongruent joint. Okay. And this joint is classified as plain synovial joint because of the saddle shape of the articular surfaces. Okay. The superior portion of the medial clavicle will not have any contact will not have any contact to the manubrium at all. But this superior part serves as an attachment for the sternoclavicular disc as well as the interclavicular ligament and also interclavicular ligament. So this gives attachment to the superior portion of the sternal end of the clavicle. Does not have any contact with the manubrium sterni, but it gives attachment to the articular disc which is present inside the joint as well as the interclavicular ligament. Okay. At rest, the joint space is wedge shaped. At rest, the joint shape is wedge shaped and open superiorly, and it will open superiorly. Okay. Movements of the clavicle in relation to the manubrium, movement of clavicle in relation to the manubrium results in changes in contact of that areas between the clavicle and the sternoclavicular joint disc and the manubriocostal cartilage and also any movement which takes place at the sternoclavicular joint will also causes movement on the lateral side of the clavicle and also which is having connection with the scapula. So the movements which are caused at the sternoclavicular joint also causes movements in the acromioclavicular joint as well as the scapula movements on the thorax. Okay, and the important thing you have to remember is the movements of the clavicle. So movements of the clavicle in relation to the manubrium, results in changes to the areas of contact between the clavicle and the sternoclavicular joint disc which is present inside the joint and also manubriocostal cartilage, manubrium as well as the first costal cartilages. So here the movements of the clavicle taking place in these areas only in relation to manubrium. Okay, this is about the sternoclavicular joint. So a disc is present inside the joint. This disc will reduce the incongruence of the joint and which increases the articular surface area, articulating surface area and makes the joint congruent. So that is called sternoclavicular disc. So sternoclavicular disc we are going to see in the next session. Thank you.